Joining us now, we have NBC News national affairs analyst and a partner and chief political columnist at Puck, John Heilemann, co-founder and CEO of All In Together, Lauren Leader, and Vanity Fair's Molly Jong-Fast is still with us as well. So, Joe, where do we begin?
Well, I tell you, they're actually interrelated. If you look at the vote yesterday, the budget resolution yesterday, and you look at the controversy surrounding DOGE in red state America, where you have people that are actually going, and now I guess they're going to stop having town hall meetings because they don't like what their constituents are saying at town hall meetings. That's, I guess, the order coming down from the top. John Heilemann, though, if they think these DOGE cuts are hard, it's hard. It's difficult to express the political fallout that they're going to face when they go slashing Medicaid, veterans benefits, all of these other benefits, FAA safety, Food and Drug Safety, National Institutes of Health, Alzheimer's research. You just go through all of it. But I want to just focus for a second on Medicaid, because there's this misunderstanding among a lot of Republicans I talk to. They think there's like inner city hospitals. They just do. They don't understand that cuts to Medicaid savage red state America the most. There have been so many rural hospitals that have been shut down over the past 10, 15 years. They're understaffed. About 75% of rural hospitals don't have an adequate number of health care providers. 50% of children in rural America, in red state America, 50% are taken care of in rural America of children by Medicaid funding. Where do people's parents go when they put them in nursing homes? Nursing homes funded in large part in rural America by Medicaid. Like, these cuts they're talking about are going to savage red state voters, children, the elderly. And why? Because they have to pass Donald Trump's tax cuts for billionaires and millionaires. It's just not a good political equation for them. This is not a winning hand for any party, let alone this Republican Party.
Well, yeah, for any political party, Joe, you'll excuse me. I've woken up with a frog in my throat. If you can't understand me, I'll shut up. I may not be able to speak. They're walking into a political buzzsaw here, where if they think that the pushback they've seen so far at these town halls has been problematic and it has been so bad that they're shutting them down, you can't imagine what they're about to hit when they try to cut $300 billion out of Medicaid, which, as you said, touches both red and blue states and districts alike. It is going to be, I think it's going to be politically impossible for them to be able to make that level of cuts. And that's where we're headed in this debate. Sorry.
Well, I mean, yeah, no, that's okay. And you saw, Molly, you saw the Congressman Lawler, Mike Lawler, talking about no cuts of benefits for Medicaid recipients. They're not going to be able to pass this budget and fund Donald Trump's tax cuts for billionaires, millionaires, multinational corporations, the richest Americans. They're not going to be able to extend those tax cuts without slashing Medicaid. And they basically said so in the outline of where this money was going to come from. That not only impacts, I talk about red state America. Red state America is not just in Kansas or Wisconsin or central Pennsylvania. That's also where I lived for a while, upstate New York. Yeah. And that's something that a congressman who may want to be a governor of the state of New York is going to be thinking about. And there are a lot of other Republican congressmen and congresswomen that probably understand all too well that these cuts are going to hurt red state America as much as blue state America.
Well, you have to remember yesterday, Mike Lawler voted for this $880 billion cut from Medicaid. So the question is, that's quite a lot of money. It would be over 10 years, but it's still quite a lot of money. And I think, from what I understand, and I talked to Leader Jeffrey's office yesterday, and they, their message to the members of Congress is that they should go out and fight this thing. And what they're seeing in town halls on the Democratic side is a lot of anger and action, and you even see this with the polls, right? This is not something that is popular on any way, shape, and form.
Well, you see it at the town halls, but they don't want to have them anymore, which I think is a way of actually sabotaging these Republican members of Congress who need that feedback to know where they stand so they can represent, Lauren, the people who voted for them.
Yeah, well, they did this. Let's remember this happened in 2016, right? When many organizations, really kind of pulled people together to show up at town halls and organize around them. And they shut them down then, too. And then the people just showed up at their offices and stood outside day after day after day demanding why they didn't hold meetings. And by the way, several of the representatives, including Congressman Frillinghauser in New Jersey, lost their seat immediately after that. That was someone who had been in Congress 30 years.
Wow.
He lost his seat after he refused to meet with his constituents. We were in Texas this weekend and did a training for women, low-income women in that community, many of whom are served by the very benefits we're talking about. We had 250 women show up at the Houston Food Bank to get trained on civic and political leadership because they are seeing the effects, even already, of the cuts. Folks who've lost their jobs, et cetera, are extremely concerned about the future. And I think, while it felt a little slow in the lead up the last few weeks, this sense of paralysis, there's no question Americans are really waking up. And, the political cost is real, but I just don't want to lose sight of the human cost. Already just the frozen, freezing government spending. Story today about a young child with cancer whose treatment has been halted because NIH is not getting the funding that was required for his clinical trial. I mean, there are thousands and thousands of really human impacts.
And I think it's worth just thinking about for a minute, when you cut the federal government, 30% of federal employees are veterans.
Yes, there is that angle as well. Joe?
Well, you also have, of course, proposed cuts to the VA, which I'm sure is going to be part of this equation, too.
Yeah.
We have an extraordinary crisis right now, and it's a crisis that Republicans don't want to talk about. It's a crisis that Democrats haven't talked about enough. It's a crisis both parties haven't talked about. And that is something we've been talking about nonstop for 18 years on this show, and I talked about my entire adult life. We have a debt crisis. Right now, the United States is $36 trillion in debt. Right now, you have people running around holding up chainsaws saying, we're going to cut government. Well, they're talking about, as Axios reported, just drips and drabs of government spending. $36 trillion. The Congressional Budget Office says that if we keep moving in the direction that we're moving in, if Republicans pass this budget, we are going to add another $20 trillion. Another $20 trillion to America's debt. That will cause a meltdown. We've been warning about it for a long time. That will cause a meltdown. Republicans are only the party of fiscal responsibility when Democrats are in the White House. And as I've said before, Mika, it's very hard. It's very hard to balance a budget. It's very hard to be responsible. But you do it with subcommittee hearings, and then you do it with committee hearings, and then you do it on the House floor. You do the same thing in the Senate. You work together, and nobody's going to be happy. Everybody's going to have to make sacrifices, but they're going to be reasonable, rational sacrifices. And the idea of extending tax cuts for billionaires and multinational corporations and millionaires at a time that we're in a debt crisis, and also at a time when this economy is running so hot that we have to keep interest rates up, is the antithesis of everything that every sane economist would say is the right thing to do right now. I've been talking, Mika, this morning, and we hope to get Neil Ferguson on, but Neil Ferguson wrote a column about Ferguson's Law, and it's very simple. And it was a Scottish political theorist, Adam Ferguson, in 1767, said this, that when great powers spend more money servicing their debt than they do on their military, then they cease to become great powers. And there has been one example after another example, and we're doing that right now. For the first time, we are doing that. We spend more money servicing the debt in America than we do defending our shores and defending our interests across the globe. Interest on the debt. And this deal they're talking about passing for tax cuts for billionaires and millionaires and multinational corporations that skew against workers and people who actually earn an income versus people who push paper around. I mean, this is devastating for America's economy. We cannot add $20 trillion to our national debt. And I am hoping there are some Republicans in Congress who understand they are signing our fiscal death warrant if they move forward with this disastrous plan. They have got to come up with a fiscally conservative plan, a fiscally conservative approach to save this country's finances, because we're going over a cliff right now, and everybody's talking about Doge, and they're holding up chainsaws at CPAC. That is smoke and mirrors.
Yeah.
It's a joke, and it's going to put this country in an even more dangerous place fiscally. There has to be a few conservatives left in Congress. There just have to be, who understand we have to get responsible fiscally and get our house in order.
So to your point, Molly, about veterans, coming up a little later, we're going to have a freshman Democrat who is a veteran himself, who is introducing legislation that might protect veterans. So we'll talk about that in just a moment.